I actually began my Neighborcare, health career since I was 6 months old when my parents came into the country.
I'm also a lifelong patient. I've been a patient since before I was born. My whole entire family are patients of Neighborcare still.
Growing up, being part of the community, coming to Neighborcare, I didn't see a lot of people like myself. But over the years, it has grown and we're more abundant now.
I, interestingly, had not heard of Neighborcare up until about the year before I joined. And when I learned more about Neighborcare and the mission and the value, the fact that it's a community-based health center, I thought it was a great opportunity for me to get involved in a way that felt more meaningful to me.
And it just makes me so happy to see someone through on their healthcare journey with us, to see someone getting the result that they have been working so hard to reach and they're there, or to get that appointment that they've been waiting for so long, and to be able to help people to get the care that they need brings me so much joy and so much happiness.
My connection to the mission at Neighborcare is the service commitments. They really resonated with me. Respect, caring, trusting relationships. An organization that emphasizes the humanity of its patients is something that I really gravitated towards.
So I'm Nanette Ginsburg and I'm 63. I'm a great-grandmother. I enjoy spending time with my family, especially my new great-grandchildren. I've been coming here to Neighborcare High Point since my daughter was young, so it's been over 40 years. I'm calling it a life change, and I am 100% committed to myself to see this through, and I don't have an easy time following things through sometimes, but this I am committed to 100%. One of the reasons that I love coming here is because I feel heard, I feel validated, I never feel rushed, and it's who I love is Lexi. I think we've gotten to know each other pretty well after a while, and she knows who my doctor is, and just helps me in every way possible receive the best care that I can. And I like to feel bonded with my healthcare team, and I actually call them the dream team. Everyone is just behind me 100%.
Like my first interaction with Nanette was through my chart. She had sent the message trying to get a schedule with Catherine Payton. And ever since then, it's just been my commitment, not only to Nanette, but all of the patients here, to use what I have within my bandwidth to get them connected to their primary care doctor. And I definitely want to make sure that you get connected in the right time manner, because we don't want to create gaps in your healthcare.
They treat people like people. I mean, they really care about us. They do. They do. They have so much patience. When I come here, they have so much patience with me, because I don't like to be touched. I don't like to do nothing, but I've come over a lot of that, and that's why I love it here. Jody, she's like a big sister that I can tell her things I can't even tell my own family. Even though they know, they try to pretend like they don't know. And she's sister, she listens, but she really listens to me. It's not just her, like, oh. And then she'll look into stuff where she can help me. Places where it can help me out, the things I need. She's a good person. She's a big sister.
Penny has grown so much, and she knows I'm here Monday through Thursday usually. But today
and I'm there when I know she's there.
Jody! She walks in and says, Jody! And I'm like, oh, that's Penny, gotta go. Yeah. And her joy is definitely the hygiene bags.
And I make hygiene bags for homeless men and homeless women. I've been doing that for many years, because even when I was homeless, I was always giving, because I was homeless for so long. I think it's need to be done. Somebody has to do it, because I can't help nobody if I'm not healthy, And they taught me how to love myself and stuff like that. So I'll say this place.
Having that understanding that we have each other's back and we treat each other with respect is, I think, really important. As we grow and strengthen our connections and build that trusting relationship between our staff, we're able to give that same care to our patients.
I just want to say that you professionally are whiz bang, okay? I mean, top notch. And I actually, when I first called the office about you, I told them how lucky they were that you work here, because I can just see when I watch your interactions with patients how much that means to them. Yeah.
Thank you. Nanette, you alone, and like all of my other patients, the reason why I am here is not for my compensation. I'm here for this. I'm here to really help you. So I'm here because of you and the rest of the community, and you give me so much hope just to be a small part of your healthcare team.
And I feel so blessed to be able to be a part of such an amazing, magical place and to be able to help so many people.
Hand in hand, we all have to come together and work together to provide that care that we all need, and we need to work together because we're in it together.